This is a recording of a review of Autism Spectrum Disorders, ASDs for short. The author is Dr. Chiang Ka-man, a second-year resident of the National Psychiatry Program. The objectives of this review are to understand the prevalence, diagnostic criteria, basic management guidelines, and prognosis of ASD. The outline of this review includes the definition, diagnostic criteria, epidemiology, etiological factors, comorbidity, management guidelines, and prognosis of ASD. Autism is a disorder with symptoms from each of the following categories: qualitative impairment in social interaction, impairment in communication, restricted, repetitive, and stereotype patterns of behavior or interests. The term spectrum refers to the wide range of symptoms, skills, and levels of impairment or disability that children with ASD can have. It is one of the disease entities of pervasive developmental disorders, PDD, in the DSM-4 criteria, which comprises autism, Asperger's syndrome, Rett's syndrome, childhood disintegrative disorder, or pervasive developmental disorder not otherwise specified. PDD emerged before the age of 3 years. Asperger's syndrome is a form of high-functioning autism, which can lead to difficulty interacting socially, with repetitive behaviors and clumsiness. The main distinctive features from autism is that there is no speech or cognitive delays. In fact, some may have above-average intelligence. The DSM-4 criteria for autism includes qualitative impairment in social interaction as manifested by the use of multiple nonverbal behaviors such as eye-to-eye gaze, facial expression, body posture, and gestures to regulate social interaction, failure to develop peer relationships as appropriate to developmental levels, lack of spontaneous seeking to share enjoyment, and lack of social and emotional reciprocity. The second one would include qualitative impairments in communications as manifested by delay in the development of spoken language, impairment in the ability to initiate or sustain a conversation, repetitive use of language, and lack of varied, spontaneous make-believe play. The third criteria include restricted, repetitive, and stereotype patterns of behavior as manifested by preoccupation with restricted patterns of interest that is abnormal in intensity of focus, inflexible adherence to specific routines, repetitive motor mannerisms, and preoccupation with parts of objects. One in 88 children has been identified with an autism spectrum disorder, according to estimates from CDC's Autism and Developmental Disabilities Monitoring Network. ASDs are reported to occur in all racial, ethnic, and socio-economic groups. The male and female ratio is 4:5:1. Studies in Asia, Europe, and North America have identified individuals with ASD with prevalence of 1%. The etiological factors are divided into genetic, biological, and environmental factors. There is a 50 to 200 times increase in the rate of autism in siblings of affected individuals. The concordance rate is 36% in monozygotic twins and 0 to 27% in dizygotic twins. There is an association with inherited genetic diseases. For example, 1 in 4% of children with autism have Fragile X syndrome, and 2% of children with autism have tuberous sclerosis. There is a high rate of mental retardation and seizure disorders, which supports the biological basis of ASD. Perinatal insult or obstetric complications are reported more often in autistic children. However, child-rearing practices do not account for it. There are various comorbidities associated with ASD. They are depressive disorders, anxiety, learning disability, obsessive-compulsive disorder, attention deficit hyperactive disorder, tic disorders, impaired cognition in various domains, and epilepsy. Treatment options are geared towards patients' particular needs and delivered in a multidisciplinary approach. For the child, applied behavior analysis, which includes one-on-one teaching approach, reinforces various skills and can be delivered in the occupational therapy, physiotherapy, and speech therapy. Medications are prescribed for symptomatic treatment of mood or behavioral issues. For the family, psychoeducation, support, and parenting programs specific for ASD can be given. ASD is a lifelong disorder, and most symptoms remain for the rest of the patient's life. The main predictors of good outcome include early speech acquisition by 5 to 7 years and high nonverbal intelligence, IQ above 70. Most people with autism are able to live with their families in the community. The outlook depends on the severity of the autism and the level of therapy the person receives. In conclusion, individuals presenting with ASD exhibits a wide range of degree of impairment. The major deficits in an individual with ASD include language impairment, oddity in social interactions, and repetitive behaviors. ASD is 4 to 5 times more common in males. A biological basis is increasingly recognized as the etiology of autism. Key workers should be aware of the multiple comorbidities that often accompanies the diagnosis of ASD. Therapy is most often delivered in a multidisciplinary team and is aimed both at the child and their families. Although it is a lifelong disorder, the outlook depends on the severity of the disorder and the therapeutic measures the individual is exposed to. Thank you.